Hi everyone, Doug Grant here. Welcome to another podcast of Holistic Professional Success. And today we're going to be talking about acid and really what you should know and what you should be teaching your patients. Hi everyone. Today we're going to be talking, like I mentioned, about acid, but very specifically the acid that comes from certain drinks and foods and the damaging effects to your body. So just to be able to set things up, I know most of you health professionals know this, but low-grade chronic inflammation is one of the leading causes of disease, death, and disability today. So low-grade chronic inflammation. So we're not talking about bam, getting hit, and it swells up in inflammation, but chronic, low-grade over time. And that's one of the major factors. And one of the things that does it is the balance between acid and alkaline. It's one of the major factors that creates low-grade inflammation or relieves inflammation completely in the body. The more acidic we are, the more inflammation that can occur. And the acidity can be in many different places, right? The last place it's going to be is in the blood, because if our acid-alkaline balance changes even more than a tiny bit, we die, right? So the body will do everything it can, the bicarbonate system, everything's going to go into place to be able to keep our blood a certain alkalinity or pH, if you would. And so now we look at the acid being pushed onto other places in the body and the cells and the organs and the muscle tissue and your fibers and your tendons, and everything else will suffer so that your blood can be able to keep the same pH. And many times we build up that acidity in places that cause problems. And as you know, acidity leads to a lack of oxygen. Alkaline leads to oxygen. And so we have a lack of oxygen, we have acidity, we get things like cancer and about every other disease. So low-grade inflammation can lead to either one of these diseases or just to, a shorter life. And so we want to be able to get rid of it. So what are the things that cause this acidity in the body that we can get rid of? And one of the biggest things, and those of you that know me and have followed what we've taught or been around me for the last 25 years know what I'm going to tell you right now, right? That one of the major causes of acidity in the body is carbonation, sodas. And I tell you, that just always gets people going, well, I just drink diet soda then, or I don't drink colas. I just drink, the Clear Time, the 7-Ups and those types of things and Sprites. Everyone has this theory as to what will make their soda less acidic. And the truth of the matter is, if it's a soda, that means it contains carbonic or phosphoric acid. And carbonic and phosphoric acid are acids that make things acidic. And so that's the problem. I don't care if it's Perrier water, Coca-Cola, Dr. Pepper, they all contain the carbonic or phosphoric acid. So now are some worse for you because of the added sugars, of the added other chemicals and things that are absolutely, but we're talking about one thing right now, and that is acidity. And so we really want to take a look at the foods and the things that create this acidic environment that can lead to chronic inflammation, disease, shorter lifespan. Sodas are number one, really are number one. Just came out with our new book, Nutrition 101. Make sure you call and ask for a copy of it. But in there we talk about the latest research on soda pop sales from 192 servings per person in 1960 per year. So for every year, 192 servings per person was the average. This is 1960, okay? It went up to 493 servings per person per year in 1976. And that number translates the 76 number, 20 pounds of sugar a year. Think about it, it's more than one soda a day. That is absolutely nuts. And so now it's actually increased tremendously, even more, up to about 170 pounds or around 170 pounds of sugar in a year. The average American consumes more than two sodas a day. And for those that don't drink soda very often, that means the average is taking in more than that. But if you take a look at it and you question those numbers, look at the size of the sodas. 64 ounce. Gosh, you're getting, 62. Boy, you're getting up to 4 sodas in one in one big gulp. And so it goes to show the problem. A lot of people drink multiples of those a day. So the acidity in soda, we need to get rid of it. So what do? One is we have people drink water that replaces the fluid, and it's a better fluid, obviously, but then we also help with the energy. Things like we have a product called Natural Vitality, or things that give a natural energy, where people that are taking these energy drinks, everything from the Bangs to the Monsters and all those things, the Red Bulls, that they're able to still have some energy, but from a whole food source as they start to get their metabolism going. So cut people off cold turkey. It's kind of tough if their acidic sodas also contain caffeine. So having something like Natural Vitality with it, or a good whole food caffeine that they can have for a short time, would be great. So that's sodas. That's one of the biggest factors today of acidity. Another major acidic food that we consume is red meat. And there's all these arguments about red meat and those factors, just more acidic. That's just a fact of nature. For example, a great way to know this so that you don't have to argue with people or to tell them, I heard it's not, that's just a bunch of bunk, they're just against the Cattlemen's Association and all that. It's real simple. Find someone that has gout and ask them, what meats can they not eat? Red meat, number one, and a lot of times shellfish, because of the acidity. So red meat is acidic. What we want to do about that is, if you're ever going to have it, take a bunch of digestion enzymes, but try to stay away from the red meat, stay away from that acid. And that will cause, the acid causes a lot of problems in the body. It causes uric acid. They turn into crystals. They go to the farthest place away from the heart, usually the big toe, gout, those types of things. So number one, sodas. Number two, red meat. Those are your top two acidic foods. And the other, I'm going to go over two others. The other two really aren't talked about that much, but it's fried foods because of the acidity of the fried. And then also sugary or high glycemic foods like white flour, those types of things. You think, well, those aren't always acidic. I mean, come on, what's acidic about it? It's the nature of raising your blood sugar levels too fast in the body and the acidity that's caused from that. And some people will call it oxidation. That's caused from that happening too much, but it's an acidic movement. Is it as bad as far as acidity is concerned as red meat and soda? No, absolutely not. But before I get off on the wrapping up of this, I missed one thing that's really important. When I say carbonated drinks, we're getting off carbonation. Does that just mean soda pop? No. Alcohol is carbonated. Beer is carbonated. So all of those increase your acidic level in the body. So we need to, at a minimum, not take in acidic drinks, carbonation, alcohol, on a daily basis. Is it good to get rid of them? Probably so. But if you are going to have it once in a while, that your body can then take that acidity that you put in that one time and handle it. But it's that consistent acidity that causes the problem, having it all the time. So I have people come and say, well, Doug, then I'm going to drink. What do I drink? And it's funny because I went and looked up different things and said, well, things like Guinness or that are more of a raw type beer. And so I've had people come back to me and say, well, Doug said it was okay to have alcohol as long as it was like Guinness or just some nice red soft wine and that. I'm not saying that. I'm just saying that the lesser of the evils when it comes to acidity. If you look at the acidic levels of those alcohols, which one is the best? But still, we're looking that beer and alcohol is carbonated, just like the soda is. So when I'm talking about carbonated drinks, I'm clumping those all together, and then the red meat, fried foods, anything that's high glycemic, white flour type products. If you'll work with your patients to be able to eliminate acidity in the diet and start with those basics, and I know there's more, and there's the alkaline diet. Basically, if you get off those foods, you're going to be eating more vegetables, more berries, obviously the really high alkaline foods, cucumbers and that, and you're going to be able to make great improvement. So instead of really laying out this giant plan that might be tough for people, just talk about the most acidic foods and try to steer them away from them, start making better choices. And as you do that, doctors, you're going to find that your patients will create a more alkaline environment so that the other things you do, the other treatments you do, will go a long ways to working faster, working better, and holding longer. So that's it for today with this podcast. Simple and sweet. Just something to remind you about the problems of acid today. And with the stresses and everything going on, we have enough acid buildup. Let's not add more because of our food. You can do this. You can help your patients do this. Just one bite at a time. And always remember, keep chewing.